Hello and welcome to this podcast brought to you by the Isle of Man Anti-Cancer Association. My name is Malcolm, a former surgeon and presently chairman of the Isle of Man Anti-Cancer Association.
And my name's Sandy. I'm the Executive Officer of the Association and a cancer survivor. In this podcast, we want to raise awareness of cancers of the kidney and urinary tract. The kidneys and urinary tract comprise a system for draining fluid and many waste products from our bodies. The urinary tract consists of the ureters, the bladder and the urethra.
Let's start at the top end with the kidneys. The majority of us have two kidneys, normally situated on each side of the spine behind our stomach and pancreas, although they may lie lower down and even be joined into a horseshoe shape within the pelvis. Tumours of the kidney are normally called renal carcinoma and generally affect those who are over 60. It is the seventh commonest tumour, affecting around 15 individuals on the island each year. Being overweight and smoking are risk factors for renal carcinoma. Occasionally a young child can develop a tumour from the embryonic cells within the kidney, which is called a nephroblastoma.
The symptoms associated with a renal carcinoma are blood in the urine, known as hematuria, which is the commonest symptom, a lump in the upper abdomen where the kidneys are situated, pain or discomfort in the flank or back on one side, although the pain may also go round into your lower back. Some people may have vague symptoms including weight loss, a high temperature, very heavy sweating, which is often at night, tiredness, loss of appetite, or a general feeling of poor health. Occasionally, a tumour may be found incidentally during a scan of the abdomen for an unrelated condition.
Tumours of the ureters, which drain urine from each kidney into the bladder, are rare. Hematuria, which may be associated with pain in the back on one side due to partial blockage of the narrow tube, are the common symptoms.
Bladder cancer arises from the cells on the inner lining of the bladder. These cells can form small, polyp-like structures which can be present for some time, and if detected early enough can be treated without the need for major surgery. Bladder cancer is slightly less common than renal carcinoma and, again, is predominantly seen in the over 60s. Being overweight and smoking are risk factors for the condition, along with recurrent and long-term urinary tract infections, bladder stones, previous radiotherapy to the abdomen, or treatment with certain chemotherapy agents.
The commonest symptom again is blood in the urine. This is usually painless and intermittent. It may only appear after micturition has started, be red or brown in colour, or even only detected on a urine sample tested by a doctor or practice nurse. Less common symptoms include a need to urinate on a more frequent basis, sudden urges to urinate, or a burning sensation when passing urine.
Cancer of the urethra is rare. It is more common in men, as the urethra in women is fairly short. Symptoms include a lump or growth on the urethra, pain or bleeding when urinating, trouble voiding or passing blood from the urethra, or back pain, weight loss or fatigue.
The commonest symptom of tumours affecting the urinary tract, as we have said, is blood in the urine, known also as hematuria. Remember, the blood may not be very obvious, with only slight pink tinging or darkening of the urine. Some foods, such as beetroot, or even some medications, may give rise to abnormal discoloration of the urine, but a sample taken to your doctor's surgery can easily be tested for the presence of blood using a dipstick test. Blood in the urine can also be associated with benign conditions such as infections or stones somewhere in the system. However, it is important that you see a doctor or practice nurse. If it is due to an infection, it will usually respond to simple treatments, and stones in the system can often be treated by relatively simple surgery. But if it is a tumour, then the earlier you seek treatment, the better the chances of successful treatment and the quicker that you'll be back to enjoying your normal life.
There is lots of good information available about cancers that affect the kidney or urinary tract. NHS UK, Cancer Research UK or Macmillan Cancer Support. They've all got good web pages with more information. You can also visit the Macmillan Cancer Information Centre up at Nobles Hospital, or you can call them on 650735. Or just have a look at their website, which is macmillan.org.uk. Thank you for listening.